lived the conventional American life. I was a workaholic, perfectionist, overachiever, people pleaser, just eating processed food and, loved anything sweet. Had no idea there was a problem because I felt fine. I was functional, even though, symptoms started creeping in at the end of high school, some gut issues my junior year, some brain fog and depression my senior year, but I was functional. But then 1 month into journalism school at Rutgers University, I just crashed. My whole body, it felt like kind of like a system shutdown. I was not very functional most of college. And so that set me on my health journey.
Hey everybody, Dr. Joan Ifland here, and you are at Conversations with Dr. Joan Ifland. And today I have a very exciting guest. It's Manya Ronay. She is a internal family systems practitioner, certified health practitioner. And I am so excited about this because I personally, in the last 2 months, have benefited incredibly from the internal family systems approach. I have been doing some kind of therapy for 40 years. I started when my children were born and they're turning 40 now, so I know how long it's been. The internal family systems approach has given me so much freedom from my childhood trauma that I am just thrilled that we have a practitioner in Manya to walk us through this incredible liberating process. So let me start out by asking Manya how she came into recovery, what has worked for her, so that you all can be inspired. Manya,
so
hello.
Thank you, Joan. Thanks for having me. So, yeah, I mean, my recovery journey started when I was 18. I had, lived the conventional American life. I was a workaholic, perfectionist, overachiever, people pleaser, just eating processed food and, loved anything sweet. Had no idea there was a problem because I felt fine. I was functional, even though, symptoms started creeping in at the end of high school, some gut issues my junior year, some brain fog and depression my senior year, but I was functional. But then 1 month into journalism school at Rutgers University, I just crashed. My whole body, it felt like kind of like a system shutdown. I was diagnosed with POTS, a chronic autonomic nervous system condition, which I later learned is just a manifestation of an overactive stress response in the brain. There was actually nothing physically wrong with my body, even though it felt like full body symptoms like dizziness and lightheadedness and GI stuff and insomnia. And I was not very functional most of college. And so that set me on my health journey. Conventional medicine didn't really work. And just luckily, because everything else failed, I found holistic medicine. The first step was switching my diet, getting rid of the processed food, figuring out how to cook and eat real food. And then slowly from there, from the external physical health stuff to the, mental and emotional world, which eventually brought me to internal family systems.
Yeah. How did you choose to train in internal family systems? I mean, there are zillions of programs out there.
Yeah.
How did you choose that?
It's such a good question. All along my recovery journey, I was graced with like the right people at the right time.
Wow.
So for example, after I did nutrition, then I found, this acupuncturist that really helped. And then, I found this program called Psyche that works with subconscious beliefs and trained in that. That was my introduction to, our subconscious mind is very important, but I wasn't ready yet to go into my childhood trauma. So that's what I needed at that time. Then I trained in Reiki. I did so many different things. And then once I moved to Israel, my therapist just happened to practice IFS, and she practices a million modalities, but she just felt like IFS was right for me. And it just hit home right away. And a year later, I trained in it and I did level 2. I'm about to do level 3. I was a program assistant for level 1, so I really dove straight in.
Right. Well, I have to tell you that really, thanks to your influence, I started IFS a couple of months ago. Now, literally, I have done personal therapy. I did a women's healing group. I've done 4 different 12-step groups. I trained extensively in a tapping system. And yet, now I will say that I have been in the ARC for 6.5 years, feeling increasingly secure. So in my family of origin, there was no security. It was a very cold environment, so there was no nurturing, and there was periodic violence, and there was always fighting.
Yeah.
So I have to say that being in the ARC for these 6.5 years among people who are always kind, always patient, always compassionate, always understanding, always uplifting, always affirming, just living in that environment. It's a virtual environment, but we broadcast 15 hours a day, and we have written messenger pods all the time, and the Facebook group all the time, and we send out a daily podcast, and we send out a daily newsletter, and we assign advocates, and we have a big library. So it's possible to immerse myself, and that's what I've done for the last 6.5 years. And of course, I work in the ARC. So in this very safe environment, I think that my subconscious was confident and secure in raising worse and worse things happened to me in childhood. And maybe it's just, the graciousness of the universe that put IFS in front of me after being in that environment.
Yeah.
But I have to say, I have had, I don't know, maybe 6 or 7 sessions with this therapist, and I am shocked at how my subconscious has pushed issues to the surface, and how, for me, it was easy. As soon as something appeared, a protector, a part, I could go to this therapist, and she could coach me through how to reassure this part, love on this part, comfort this part, and then the part would just let go. It'd be so happy that it didn't have to protect me from whatever anymore, that it would happily go off and do something else.
Yes.
My asthma has gotten so much better as a result of this. All those protectors were like, don't breathe, keep your head down. And now they're all like, okay, well, I'd rather go over here and play cards or do something than have to, keep you clenched down. They're so happy. They cry with joy, these parts. So I'm just in awe. Anyway, tell us if you feel like you can, and keep confidentiality.
Yeah.
What are some examples of, like, I'll give you a good example. When I was a child, we didn't have much. Like, nobody bought us toys. There was a toy chest, but it was the same toys over and over again. But when we went to the grocery store with my mother as children, we were allowed to get one thing. And of course, I always got something sugar, because like you were just starting to talk about, in my environment, anything that would numb was attractive. Like, there were so few sources of comfort in that environment, that the numbing substances, the sugar, the flour, the dairy, the excessive salt, the gluten, the excessive fat, and the caffeine, and even in the 1950s, when I was growing up, it was also there were food additives. That was a big spot in my life. And in all those years of therapy, like, I would go to the grocery store, and I would have to fight like heck to get out of there without, one, gray area item. I wouldn't go for the sugar, but the idea that I was going to leave without something was just almost impossible. And then right away, almost in this IFS, we found that protector. We found that little girl who just like, what do you mean you're leaving the grocery store? I haven't got my special thing yet. And we comforted her, and we found her some other things to do. And I go to the grocery store now. It's an entirely different experience.
Amazing.
So what are some examples of what you've worked on.
Yeah. Well, I just want to comment on this story. It's so beautiful, and it just shows how, our parts, these protector parts, are so young, and they come online, because of an overwhelming life experience that creates
Mhm.
this wounded little child, we call them exiles. And the protector is just on guard, protecting that kid for decades, thinking we are that kid. They don't know how old we are, they're doing the same job, and they're so relieved when they can just
It's
relax.
amazing. They cry with relief.
Yeah.
They sob with relief.
Yeah. And it also shows that, all parts have positive intentions, even the ones that
Mhm.
cause problems, like the ones that use addictive substances. They're all just young, using the only coping strategies they know. So it gives us
Yeah,
more compassion for them. And once we
yeah,
get out of that fighting, the whole system just relaxes, and amazing, your asthma could relax so
yeah.
quickly. Yeah.
This has been huge. Like I used to be able to feel my chest was just clamping down, and
Amazing.
it's the outside, the muscles on the outside, the chest and the back. That is gone. It just
Yeah.
doesn't happen anymore. And it's so I've only been doing this kind of therapy for maybe 2 or 3 months. It's just so incredibly effective. I think it's effective because, as I said, I was really, really, really in a secure
Right.
place
Yes.
and very motivated. And I'm
Mhm.
doing a lot of other things. So, of course, I'm eating clean and I'm doing
Mhm.
sound therapy. And um, my therapist said that all those other, the sound therapy and the meditation and the being in a secure community, the visualizations, the tapping, all that does also help these protectors to release.
Yes.
Yeah.
Yeah.
Oh my gosh,
Yes.
I'm just on fire for this.
So, I also want to add, like, these protector parts, usually they're managers, I think, that are holding us so tightly, to try to just keep everything inside, to keep all that
Mhm.
pain and wounding that they're so scared to let out. They think we can't handle it because we couldn't when we were
Yeah,
little.
yeah.
Um, and so when these parts can relax, like for me, these managers were like the perfectionists and the people pleasers and the overachievers, and I just have to do everything perfectly and take care of things right away. And when they start relaxing, like, life is just a breeze.
It's so different. I'm doing the same amount of work. I'm
Mhm.
doing the same work. I love what I do, but I'm doing it without panicking. I'm enjoying it.
Yeah.
I'm enjoying my work so much more without, and yes, I had that manager too. There was a point when my brother and sister, to deal with the pain in the household, they went towards, alcohol and drugs
Mhm.
and partying. So I was the only one who could keep my parents from the humiliation of all three children going rogue, if you will. And so I took on responsibility for their mental health. These are
Yeah.
two pretty darn sick people. And became that achiever, the achiever that
Mhm.
you were talking about. So,
Yeah.
Manya, this is just amazing. I'm so grateful to, and so that if you're interested in this, the book, well, Manya should recommend the book. I've been reading No Bad Parts by Richard Schwartz, who created this system. Manya, how would you recommend somebody get started with IFS?
Yeah. So, there's another great book called Self Therapy by Jay Early. It's very
Ah,
basic, um, walks you through the model, but it can be hard for people to start on their own. Some can. So it's really good to start with a practitioner, even just for a
I
couple
agree.
sessions.
I
Yeah.
agree. I agree. I couldn't agree more because, my childhood was so awful. And I got this advice from another person trained in IFS,
Mhm.
but a friend, somebody that I couldn't really
Mhm.
work with, to imagine that your heart is a garden, a beautiful,
Mhm.
beautiful garden, and your parts are hanging out there.
Mhm.
That imagery has made it so much easier for me to identify the stuckness,
Yeah.
the voice. I can look down in that garden and I can see who's upset.
Uh-huh.
They kind of focus on that and that part. And then this is the amazing thing about IFS, and Richard Schwartz is exactly right. those parts have a voice. They're
Uh-huh,
what they're
uh-huh.
thinking, doing, saying their purpose. It will the thoughts will come up in your head.
Mhm.
And the reason why I said, "Oh, I've got to get a therapist," is one day I looked down there and there were thousands of
Wow.
these parts. So it's like you look off into infinity,
Wow.
and there they all are. And I said, okay, I don't know what to do about this. I need to go get some help.
Yeah.
Yeah, yeah.
Yeah, amazing.
So, what? Tell us more about your
Yeah.
background. So you've tell us how long you've been in the Ark, and I know you've shared with me your food was already clean when you came into the Ark, but you felt like something was missing. Tell us about that.
Yeah. So yeah, I'll tell you the story. So I graduated from journalism school. I knew I wanted to do something health related. I actually wrote my undergraduate thesis on processed food and chronic disease. It was one of the first articles actually out about processed food, at least like in the lay press. And it went it went viral actually. And that's actually I started working with Dr. Robert Lustig after that, doing his social media. And so I knew I wanted to do something health related. So I took a year off after graduating from journalism school. I came to Israel. Um, then COVID hit. So then I went back home to
Mm,
Florida. Then I started this master's program in health education because at that point I hadn't started really the mental emotional work, definitely not IFS. So I thought I wanted to do like health coaching. So that's what I started after I graduated with my master's. I was a certified health education specialist. Um, and very early on in my health coaching practice, I knew something wasn't right. Like people just wanted a food plan. I just knew there was something underneath. It wasn't flowing for me. And
mm,
then I found IFS and that was flowing. I found my therapeutic presence. I was like, this is what I want to do. So I switched my practice to IFS for eating and also mind body healing. And yeah, so I've been in the arc for since I graduated with my master's. I don't know, 2 years, maybe it's been almost 3 years. I don't know. It's been some time in the arc, and it gave me community. Like for a while, when I was trying to grow my health coaching practice and it wasn't flowing, I needed the arc. The arc gave me practice in motivational interviewing, which I had learned in college, but they didn't give us enough practice. And the arc
mhm,
gave me this
mhm.
warm community. I say the arc is like a big container of self energy. In IFS, we say
What?
self is our calm, compassionate core, and it's the agent of
Yeah.
healing. Everyone has a
Mm,
self. And when we're in a group, self magnifies exponentially. So in the
mm.
arc, we just have this powerful self energy that holds us, and we can hold our parts in the same way on the inside.
Oh my gosh, I never thought of that. That is gorgeous. So if you're in a community and the community is so I understand that self, capital S, Richard Schwartz conception of that, that's our core goodness,
Mhm.
our core loveliness, it's our heart, our soul, our life force, whatever you call it. And so if you're in a community which embodies those qualities, then you'll internalize that and have that relationship with your own self.
Yeah.
I never thought of that. Oh, Manya, that is so beautiful.
Yeah.
Yeah. So
Yeah.
how did you, so you came into your food was already clean. And this is the point that I think is so important about your story is that food is about 20% of what you can heal or what you can, the joy that you can get out of life. Certainly, you get off of processed foods and onto clean foods, your joy just goes up exponentially. But there's another 80%. There are modalities you can learn, like the breath work, like the visualizations. There are communication skills, like Manya's talking about the motivational interviewing. When you communicate with somebody else compassionately and expertly, then you start communicating with yourself, and the negative internal voice goes. So there are so many opportunities to increase your experience of life as joyful. And what would you say your experience? What kinds of qualities did you get inside of you from you had your food clean, but you went ahead and took the next step and joined
Yeah.
a compassionate community?
Right. It's all those C words of self. We say self is, calm and compassionate and connected and courageous and creative. And it's all those words. I would say in the arc, it really gave me community and connection. Those were the most important. Um, yeah, we're not meant to
How
be
did you
alone.
experience those in your day-to-day life? What shifted?
Yeah, I think it's what you were saying, knowing I had a safe place to come. Because in regular life, like most people are not so, inner focused. And I have a hard time being around a lot of people with a lot of protectors. I can sense them, you
Mhm.
know? Um, yeah, so there's something about just having a community that you can come to that's safe anytime. You can share what you need. It was a very big part of my recovery, especially when I needed more support, like at the beginning of my therapy. Now I'm actually much more self-contained. I notice like I don't need it as much, so I enjoy coming in to host, but it's really cool to see that as we're able to better take care of ourselves and contain our parts, like we still need community, but we're more self-contained, if that makes sense.
Yes, yes. I'm listening to a book now about it's basically using MI with children. It's a
Cool.
parenting book. My daughter asked me to listen to it as a grandparent, and they're talking about the kind of parenting that creates these parts.
Mm,
It's shocking to hear somebody talk about the genesis of these parts and how
wow.
an adult child relationship starts to create these
Mhm.
parts. So, I had a very interesting experience recently. I decided to end a relationship with somebody I like very, very much, but they're just not reliable.
Yeah.
And I really wasn't able to sleep too well
Mhm.
afterwards. And I listened to a part from just last year. So parts can also develop in adulthood. This is a
Yeah.
part that was very upset because this was a very warm relationship. It just didn't work.
Mhm.
And that adult part was missing that warmth.
Yeah.
And then, so, I kind of got shoulder to shoulder with that adult part. And then a couple of days later, I realized there was also a childhood.
Mhm.
I like your words, but and who was so deprived of physical contact as a small child
Yeah.
that she was kicking up a fuss.
Mhm.
What do you mean we're not going
Yeah.
to? And so I was surprised to find an adult part as well.
Yes.
Yeah.
Yeah. Yeah.
So you got through it was through that mechanism of security and the ability to access, we do broadcast live 15 hours a day and people are assigned an advocate. So there is constant access of some kind, even if it's the Facebook group. And because we're around the world, on the west coast of the US, Manya's in Israel, but we have teams all over the world. Somebody is awake in our operation 24 hours a day, 365 days a year. So one last story, Manya. What is a story you have that would illustrate for our audience the power of healing?
Yeah. Let me think about it. A lot of stories. Um, yeah, I mean, I can just end a little bit more with my personal story. I'm most comfortable talking about that. With my POTS diagnosis and being very not functional and being barely able really to walk. And I was super light sensitive and noise sensitive. And through my healing journey, I'm still very sensitive. I actually am more in touch with my needs and I don't like being around large groups of people and, learning like the hypersensitivity that's innate to me, but figuring out how to calm my brain down, help it feel safe enough that I'm very functional on a daily basis. And I attribute that largely to IFS. I got to know the parts. Parts can cause physical symptoms. So I got to know the parts.
Mhm.
Um,
To give
with,
us some examples of what do you
yeah,
do to calm yourself?
yeah, yeah, yeah. Well, let me just finish just talking a little bit about how the parts can cause physical symptoms. They can
Mhm.
they were like shutting me down. There was,
Mhm.
when the system is too overwhelmed, sometimes
Mhm.
down parts, can give us various chronic conditions, depression, just knock us out.
Yep.
Um, yeah. And even just being so tightly wound up, like those
Yep.
managers, we were talking about, that can help the brain feel unsafe and create chronic conditions.
Right. Right.
Yeah.
Right.
So the more we connect with these parts, first the protectors, then the little ones they're protecting, the more they realize someone is home, that there's this strong
Yeah.
adult presence, the more they
Yeah.
relax. And then symptoms just start going away. And we have more
It's
control
amazing.
and choice. One of the C's of self that they added is choice.
Yes.
Yeah.
Yes. Well, I'm here to say that this works incredibly well. Would you like to share anything about your own personal methods for calming, for regulating?
Yeah. Do we have time to just do a super short exercise?
Sure.
Okay. Yeah. So if everyone who's listening just wants to, take a few breaths, maybe feet on the floor. I like to put my hands on my thighs or maybe one on the chest and belly, connect to the body, whatever feels most comfortable. And just scanning your body, noticing if there are any places of tension. These might be parts that are calling out for your attention. Just seeing if anyone's around, calling for you. Sometimes they show up as an image or a thought or a sensation. Just focusing on one of them, letting them know you're here, you see them, they're not alone. Just bringing some calm, compassionate presence to this part, maybe with your hand or however feels right to extend your presence. And just seeing if there's anything it wants you to know. Letting it know that you hear it, that it makes sense. Just seeing if there's anything it needs from you. Maybe giving it a hug if that feels right. Whatever feels right, just to let it know you're here. It's not alone. Maybe letting it see how old you are, all your strengths and capabilities. You're not a little kid anymore. Just taking another few breaths with the part, letting it feel your presence so it knows it's not alone. And just taking another few deep breaths, letting it know you can check back in on it. If it wants, it can raise its hand. Some parts like to journal, whatever feels right. When you're ready, thanking the part for everything it shared and gently coming back. So that's just a super quick exercise you can do, just checking in with the parts. I have some
Yeah.
longer meditations on my YouTube channel, Manya Ronay.
Thank you for mentioning that. Manya, thank you so much. I'm so grateful for you. I hear people in the ARC all the time saying, "Oh, I had this session with Manya and it was so incredible, and now I feel so much better."
Mm.
These parts are holding parts of our bodies very, very tense.
Mm.
And when you comfort these voices, the body, there is a physical response. The body releases that tension, and then blood flow can get in there, and the muscles can work, and the nerves can work. So, Manya, thank you, thank you, thank you. I appreciate you so deeply, and I appreciate your training. And go to Manya's YouTube channel, learn about IFS. You can learn about the ARC as well. Get into a safe container, a safe community. and you'll find that your progress in healing trauma, I think, really increases exponentially. See you next time. Thank you. Bye-bye, everybody. Thank you so much for coming today. I appreciate your interest. Tell the next person. You can walk the next person out of this processed food nightmare with what you learned today. See you next time.